After 400 deaths across Africa, Sweden and Pakistan confirm MPox cases outside the continent. The World Health Organization has declared MPox a public health emergency, with the new clade 1b strain of the disease being declared the deadliest ever. However, despite the many deaths, the World Health Organization has now urged the public to remain calm, stating that the disease could be dealt with as long as the right things were done at the right time. I'm being joined by Dr. Anita Ramesh, infection disease expert and specialist in clinical trials as well. Thank you for joining us, Dr. Ramesh. Now, the WHO has issued a public health emergency warning. Is it time to now deploy measures based on the lessons that we have learned from the COVID pandemic?
Yes, a very good morning. I think it is very important to keep our gears ready because, this is a MPox from the pox virus, usually spreads by contact, sexual contact, body fluid. It can also spread by cough. So what you said is very correct. We need to put all the things in place: prevention, isolation, and then awareness, early detection, and covering our body parts or PPE that is particularly marked so that you don't sneeze and cough. Sexual contacts, any blood fluids, like the precautions we took for COVID, has to be in place. So this is it's a type of global warning has been put, and we should not take the things lightly. That a number of cases are increasing, and it's outside Africa also. And though we have a vaccine, but I think at this point, everybody should be alerted, but not to be panicked. Please put your guards on prevention and prevent exposure, prevent contact.
Right. Absolutely, Dr. Ramesh, like you said, prevention is very important. Now that the cases have been reported in Pakistan as well, we had seen earlier with the case of COVID as well that a cross-border transfer of these viruses happen quite quickly. India hasn't issued advisories yet, but what precautions can we expect the country to announce?
Awareness. We need to aware everybody that there is travel restriction across the borders where the testing is needed. Secondly, cover your face, and not the face, the mouth and the nose. So your secretions, you don't get others' secretion, and neither do you get the secretion to others. If you have a suspicion that you are having fever, body pain, headache, you're feeling weak, and start seeing some blisters in the body, rashes, please report to the immediate local authorities, and they will tell you what to do. Yes, we have to gear up our testing facilities. That is the RT-PCR, that's a PCR for DNA testing. And the health facilities all over the country should gear up. And I think we are in a better position post-COVID because we have the things in place. And awareness and sexual. One more important thing, this disease spreads sexually. So it should be a barrier method. So unknown sex, please avoid. Promiscuous partners, please avoid, can be potential threat. Next is barrier. We tell for barrier methods of sexual contact will be preferable, but then everything is better to avoid. I think at this point of time, this awareness and sensitizing the nation will be of a big help, but not to panic. Yes, we can be able to control the disease.
Thank you, Dr. Ramesh, for joining us and bringing us those details.